Hello, everyone. Thank you so much for being here today. I want to first thank Judy for inviting me to talk today and to talk about a topic that frankly doesn't get enough airtime. And so thank you for taking time on your Sunday. And so today we're going to be talking about addressing body dysmorphia and body image and eating disorder recovery. And just a little bit about myself. I am a researcher. I am a clinical psychologist. I'm also a professor at Arizona State University. And so I wear multiple hats. I tried to structure this talk to really give you quite a bit of ideas or strategies or tools. But I want to just first recognize that you all may be in very different stages. Some of you may have a loved one in treatment. Some of you may be trying to get in treatment. Some of you may be in different recovery after treatment. And so what I want you to know up front is to take what makes sense to you, tweak it, make it your own. And also keep in mind that there may be something that we cover today that doesn't work right now, but may work down the road for you. And so I'm hoping that this really is a resource for you. So having said that, the goals for today or for me in structuring this talk was I do want to give some background information. And so that's the goal number one, is give some background information on body image and body dysmorphia. But I kept that strategically short so that it would allow enough time for goals number two, which is talking about the decision-making process when you hear a negative body image statement or body talk statement. And then number three, strategies for how to handle those statements. So intentionally, I've kept the background brief. So what is body image? Well, body image is your personal relationship with your body. It includes a cognitive component like thoughts, beliefs about one's physical appearance. So if I were to say my legs are weak, that is a thought or belief about my body. It can also include an affective component, which is the feelings you have towards your body. And so if I were to say, I love the color of my eyes, it reminds me of my mother and my grandmother, right? That's a feeling. It can also include a behavioral component, and this is actions you do to your thoughts and beliefs about your body. And so an example would be, checking your appearance in a reflective surface, like a mirror, a glass, a window. That could be an example. And so it's important to know that body image can be positive, it can be neutral, and it can be negative, or a mixture combination of all of those, depending on the situation, the day, the time. Yes, it can really vary. Positive body image is generally considered to encompass, having a more accurate representation of your body size, as well as comfort or acceptance with one's bodies. And then enjoying, respecting, or taking care of your body can also be considered part of positive body image. But positive body image doesn't always imply absolutely liking and loving 100% of your body. So body image is a core feature of eating disorders. A core feature of eating disorders is overvaluation of weight and shape, fear of weight gain, and preoccupation with weight and shape. And so there are two common aspects we tend to see in eating disorders, which is body dissatisfaction, not liking your physical appearance, or body image disturbance, which is where you see a distorted view of your body. And so a person can have one and not the other. You can be dissatisfied with your body and still have an accurate perception of your body. And so it's important to highlight that. I also want to distinguish that the overvaluation of shape and weight refers really to the importance somebody plays on their shape and weight for their identity or their sense of self-worth or their sense of self. But it's different in that it's thought to be stable across situations, whereas body dissatisfaction can really fluctuate based on your mood or your thoughts. So I just wanted to make that distinction. I also want to highlight that in treatment, sometimes, not all individuals have who have an eating disorder have a negative body image. That's first and foremost, that's important. There's a tremendous variability. And sometimes body image does resolve during treatment, but sometimes it does not. And so there can also be a lot of variability in terms of after treatment, if you still have a body image and where in the body image spectrum the individual lies. Body dysmorphia disorder is a obsessive, and I want to stress that, this obsessive preoccupation with one or more perceived defects or flaws in physical appearance. And these defects or flaws are not observable to other people, or they appear really slight to other people. At some point during the course of the disorder, the individual performs these repetitive behaviors or mental acts. And repetitive behaviors or mental acts are really in response to the obsessive thoughts and the extreme preoccupation with that defect or flaw. So those repetitive behaviors can be mirror checking, excessive grooming, skin picking, or a lot of reassurance seeking. Okay, they can also compare their appearance to others. This preoccupation really causes impairment and distress in their everyday functioning. And a type that you often hear in body dysmorphia is muscle dysmorphia. And that's where the individual is preoccupied with this idea that their body build is too small or insufficiently muscular. And in body dysmorphia, there are some common areas of concern that we tend to see. The face and anywhere on the face can be common areas of concern. Symmetry in body parts can also be another area of concern. And then the buttocks, the thighs, the abdomen, calves can also be some common areas that we see. It's important to note that people who do experience body dysmorphia disorder can become so fixated on these perceived flaws that they define themselves by it, and they do report a lot of shame, self-disgust, embarrassment, and fear of rejection and humiliation. So given that you are part of this community, and thank you so much for giving me time and space to join your community for these next 40 minutes. You know, I am sure that you have heard negative body statements at home, in your environment. And so using the chat function, go ahead and type in, what are some body statements, negative body statements that you have heard, and put them in the chat. I also want to point out while you're doing that you know, no one is immune to the topic that we're talking about today in terms of body dissatisfaction and body statements, body talk statements. We are bombarded continuously with pressure from society, from ads via social media, online, on the TV, and to really alter our appearance or our weight, right? It is really common for people to have body dissatisfaction, and we call it normative discontent. And even myself, as a researcher that studies this topic, I am not immune. And I continuously have to work on body acceptance and body satisfaction. And so I just want to point out, we're surrounded by this in our environment. So there's some great examples coming in that I want to say, and they're coming in so fast. My belly or my thigh are too big. I am fat. My belly fat needs more muscle. My breasts are too big. These are all excellent. My stomach looks pregnant. I hear that a lot. I look bloated. And so these are all, why am I so much bigger or fatter than my friends? These are all great examples of body talk statement. And I just want to highlight, look how quickly we're able to give these examples, right, in a very short period of time. So it is something common. And so what I hope that you leave with today is really some strategies. And so before we jump into things though, I want to just acknowledge that I want to take a moment to pause and acknowledge that addressing statements that like these that are stemming from body dysmorphia and negative body image is hard. First, we don't have enough research on the most effective strategies or how to decide what to do when, or even benchmarks. So even therapists can struggle with addressing these statements with their clients. And so it is okay if you struggle in addressing these statements with your loved ones. I think the important thing is that we try. It also will require experimentation and creativity, where you're going to have to try different things at different times to address these statements. And sometimes it'll work in one situation and the same strategy may not work in others. And so, but I also want to emphasize that, you need to give yourself permission. Sometimes you will fail, and that's okay. Sometimes you will succeed and enjoy the wins. Sometimes you will have no clue if what you said was helpful or not, because you won't get that feedback from your loved one. And then other times, a failure can become a win. And what do I mean by that? Well, you might say something to counter a negative body image statement, and let's say it's to your child, and your child rebels, and they say something like, "You just don't get it. You don't understand." And you think, well, that didn't work. And then maybe 2 months later, or 6 months later, or maybe even a year later, your child may come back and say, "Remember that Sunday when you said this? Well, that really stuck with me." And then all of a sudden, something that maybe was a failure in that moment has been beneficial, meaningful to them since then. And so the failure became a win. So all of this is to say that it's really important that you give yourself permission to try, give yourself permission to not know what to do at times, and give yourself permission to fail at times. The important thing is we're trying our best given the circumstances. I also want to acknowledge that sometimes this can be really hard because the person that's recovering from the eating disorder will make negative statements about your body or your weight that negatively impact or hurt you. These things don't happen in a vacuum. And so I just want to also emphasize the importance of compassion for yourself and permission for yourself. Okay, so I want to start by talking about our mindset and our approach going in. And I view this, I think a key question in setting our right mindset or setting a good mindset and going in is this a puzzle or a mystery? How you answer this question really dictates your approach to a problem. When you view a problem or a situation as a crossword puzzle, you believe there's a definitive set outcome, and there's a set number of strategies to solve the problem. So in a crossword puzzle, there's one word that's going to fit across or down in the crossword puzzle. And you use a set number of strategies to figure out that crossword puzzle. But now think about your approach to a mystery and think about the difference if you approach something as a mystery. The outcome is unclear or less clear. And the set of strategies you use to solve the mystery are less defined or ambiguous. So in the recovery of eating disorders, getting someone to eat can be a puzzle. The outcome is clear, and there's a finite or very limited set of approaches you can use to get someone to eat. But when addressing statements from negative body image or body dysmorphia, I really recommend to approach each situation as a mystery. I think this really helps you to be creative, to really experiment, and to be a bit more open to where things may go. The other reason I emphasize approaching things as a mystery is that sometimes the goal, or often the goal is unclear. And so you know, the body image spectrum is really nonlinear. And this is why you see in this slide a number of dots that don't connect. They're kind of in a slight, like a blob trajectory where body hate's on one end and body love is on another end, and that's intentional because it's nonlinear. People can bounce around. They can go from dot to dot. They can be all of these things in one person, right? And so when we're talking about the goal in body image, you know, we know what we're moving away from, but we don't necessarily always know what we're moving towards. And it can vary by body part, it can vary by where they are in the recovery process, and it can also vary by individual. And so we know we're moving away from body hate, and we know we're moving away from extreme body dislike, right? But that's the extent of what we might know going in. And so I think this is why I also like to frame it as a mystery. I also want to pause here and emphasize that that it's important that if your loved one is in treatment, that this is a collaborative effort. That you know, that you check in with a therapist about how do you handle these statements at home, how do you handle negative body image at home, because the one, they can help you in terms of what is the goal in relation to this. Also, they might give you some valuable information like, hold off. I don't want you to address these statements, you know, just maybe validate the emotion. We'll talk about that in a second. Because right now we're working on this goal and we're going to get there. And so we're going to get there in maybe a month, 2 months, whatever it might be, right? So just hold up. So so what you do at home, if your loved one is in treatment, should be a collaborative effort with the treatment team. They also can provide you some really valuable guardrails, because they're also trying things too. And so you can say, listen, I tried this, it didn't work. Just a heads up. And so it can really be a team-based approach in addressing these. And I also want you to keep in mind in relation to the goals that sometimes, and Diana, that's awesome that you're trying to watch your own words about your body. And that is actually a really helpful thing. Sorry, that completely distracted me. But I want to go back to the goals and say that to keep in mind that, you know, the end goal isn't always body love. The end goal is that it's okay to have some areas that you do not like about yourself. That doesn't mean that it's pathological, but as long as it doesn't interfere in you living a vibrant and satisfying life. And so the end goal is an absolute 100% body love. That's not. It's the point of having some body dissatisfaction, but it's not interfering, and you can still have a happy, vibrant, and satisfying life, which is what we want for ourselves and for those that we love, right? Okay, so let's jump in and talk about the decision-making process. There is a decision-making process that you need to consider when talking about to handle a negative body image statement or not. And so I'm going to cover 3 steps. Step one is going to be checking in with yourself. Step 2 will always be validate. And then step 3 will be implement a strategy, but you will implement a strategy depending on step 1. Okay. So we're going to go through these 3 steps. So step 1, you're going to check in with yourself. So you've heard your family member, your loved one say a negative statement about their body or appearance. Okay, the first thing I recommend is asking yourself in this moment, are you stressed? Are you exhausted? Are your cognitive stores depleted? So I want you to think of it like a cell phone battery. And in the morning, our cell phone batteries are 100%. And so each time, though, that you have to make a decision or an action, it depletes your battery a little bit. And so across the day, your mental or thinking abilities deplete. But definitely, if you've had a very emotional, stressful day, then right, you might deplete more than something else, right? Just like a cell phone. Sometimes if you have too many apps up, you're draining your battery more. The same idea, okay? So when you're confronted with a negative statement, I want you to pause and ask yourself, what's my battery level on my thinking abilities right now? If the answer is my battery is low, then you're going to validate and distract, and we'll talk about that. If the answer is my battery is good or okay, then you're going to validate and you're going to try one of the strategies that we're going to just discuss. But again, I want to pause and say that, you might think for yourself that one of the strategies I list in the my battery's good or okay is actually easier for you when your battery's low. It's fine to flop around. Use, these are just some ideas, some suggestions, and you're going to incorporate them in the way that makes the most sense for you. Okay. Okay, so step one, you're going to check with your battery. Step two, you're going to validate. And why validate? Well, validation is essential to meaningful connection. We all need validation at one time or another. And in addition, consistent and purposeful validation really helps to build relationships. And it really helps to build relationships and maintain good relationships across all relationships, no matter where you're at. And so, so this is a really good thing to do. And if you have a loved one in recovery, they've probably talked about validation, and you probably rolling your eyes at me right now, like, here we go again with validation. But it is really important, and it's helpful here. It's step two here. So what is validation? Validation means that you are acknowledging another person's emotions, thoughts, experiences, values, or beliefs. Okay, validation is not agreeing with them. It's not placating them. It's not fixing the problem, the situation, right? Or trying to get someone to change. So what do I mean by that in terms of the topic for today? So here are some sample validation statements. So let's go back to one of the statements that was mentioned in the chat. Okay, so my legs and arms are fat. I hear you. You're uncomfortable with your body right now, right? That would be one, a potential response. Depending on where they're at in their recovery process, you might even say, you might even say to them, what do you need from me right now to be able to sit with this discomfort? Could be another validation statement. And so here's it sounds like you are frustrated. It sounds like you're angry. It sounds like you're afraid. Definitely when you hear, there was one where it was, I don't want to get fat. I'm afraid of getting fat. Those sorts, you can say, it sounds like you're afraid. And notice what I'm doing. I'm highlighting the emotion, and not so much the body area, the body concern. And with validating, that's what we recommend. Identify that emotion, and it's okay if you're wrong. The other one that you can say is, it makes sense you're feeling this way because you're working really hard on fill in the blank, right? You can also frame it as a question. Tell me more about what you're thinking, right? If you're not sure where they're at, or if you have some concerns, okay? I know that you're going to receive a copy of the slides from this presentation. So at the end of my slide deck, I've provided some additional validation statements. I also have a resource page at the end of this slide deck, and there I put a link to the listening and validation exercise, which is from dialecticalbehaviortherapy.com. They actually have a video and practice worksheet for practicing listening and validation, and it's where you do the first you watch 30 seconds of a video, you do the first section of the worksheet, then you pause the video and you listen to the next section of the video and you do the next section of the worksheet. And so it can give you some more practice. And so that's at the end of the slide deck for you. Okay, so you've done step one, you checked in with your battery, and let's say you say your battery is low. So you're going to step two, you're going to validate. So now what do you do next? So in step three, when your battery is low, I want you to distract. And the goal in this distraction, distract, deflect. The goal is to stop the body talk. And how are you going to do that? Just change the conversation. And now the trick here is changing the conversation in a way that's not really out there, and so what are your plans for this morning? How did your day go? Okay, everybody, today we are going to get the laundry done. Do you have dirty clothes? Do you have homework? Hey, do you have a test coming up, right? These are ways to change the conversation, and the goal is to stop the body talk. Now, I also want to acknowledge something else that might happen, which is sometimes you have validated and you get some negative feedback. And so you continue that validation line, and that actually can by itself serve as a distraction from the body talk. So let's say you say to someone, gee, it sounds like you're frustrated. And they respond, I'm not frustrated. Geez, you never understand me, right? And so then you're going to try a second validation statement. Okay, I'm listening. Tell me where you're at right now, right? And we're going to focus on the emotion. And so hopefully they respond. And so you continue that line of conversation. You've now moved it away from the body talk, and that's a win. I know that distraction can be tricky, and the more that you can, the more tools that you have, the better. And so at the end in the resource page, I've also included a link. It is still from dialecticalbehaviortherapy.com, and it offers free worksheets and practice in distraction, but it also includes a list of potentially distracting activities. And so you could on your own sit down and work on, do the worksheet yourself, or you can actually sit down with the family member or loved one and collaboratively work on a list of potential distractions to use when the goal is to stop the body talk. And again, the idea here is distraction. We all are used to changing the conversation. We do that all the time. And so this is a lower resourced strategy for when your mental abilities are low, when your battery is low. And so again, the step is step one. You're gonna check in with yourself, see where your battery is at. Step two, validate. Step three, distract. The easiest strategy you can use is change the conversation. Okay, but let's say your battery is good. You determined your battery is okay. So you've done step one. Now you've done step two, which is you validated. What's step three? Okay, now you're at step three when your battery is good or okay, is you're going to try to handle the negative statement. And so here's a few strategies to try. There are lots of ways to go about this. Some of this may work for you, some of it may not. I just wanted to give you a couple of things, and then that might help you. And again, this should be in collaboration if they're in treatment with the treatment team. That's the most effective method to do this. Okay, so what might you try? Gratitude. And so the aim here is to shift the focus towards gratitude or appreciation of the body. And so you might ask a question. What's one thing you are grateful for that your body has allowed you to do today? Or you might ask, what's one thing you appreciate about your body right now? And now, depending on where they're at, this actually might be difficult, especially if they complain, like my arm is fat, right? Which was in the chat. And so we will take anything, especially if you're just starting this, right? We'll take any more grateful, more appreciative statement, even if it's not about that body part, even if it's not about the arms. Right? So for example, I'm grateful my brain works with no issues. I'm grateful my shoulders can carry my book bag. Again, it's not about the arms or whatever, but that's okay. but it is a statement of gratitude. It is a statement of appreciation. Okay, so that's one way. Another way to counter the statement is to have them say something kind. And you might say to them, wow, you just said something really negative about yourself. How can you be kinder to yourself right now? And again, we'll take the wins as we can get them. You know, some statements we would like to see is, it's okay if I don't like my arms right now. I am more than just my body. Or my body has been good to me today. I am breathing. I am living, or I experienced this, right? Those are some awesome ways. And now this, you know, this may take some collaboration. This can be a little harder, especially if they're in a negative moment. If they're really, really, and some of you are saying, you know, like a really negative moment, then the touch of endearment, and I just saw this, like, you know, some of these strategies might actually elicit a meltdown. And if that's the case, then this is why I've included number 3, which is a touch of endearment. And this is another strategy you might try. And so right after they've said this negative statement, and you're worried that if you do challenge it with number 1 or number 2, that you might actually you might want to try number 3. And this is where you have them do an act of endearment. And let me explain that. So for example, you could have them close their eyes, although that's not necessary, steady and focus their breath just for a few seconds, and then touch their body in an endearing way. So you might have them say, okay, close your eyes, take a breath, and now just gently caress your arm. If they said, I don't like my arms, right? That's an act of endearment. It's a touch of endearment. Again, it's just a gentle caress of yourself. It just puts them, it moves their mood, it moves their negative moment just slightly more neutral. It's also just an easier way to thing to counter the negative statement for some to do. And so again, the key here is that, you know, we're providing strategies depending on where they're at, what you can take, what you can do, what you can be creative with. At the end of this presentation, I'm providing in the resource slide a website, and it's selfcompassion.org. And at this site, I love this site. There are a number of suggestions for acts of kindness towards the body. And there's a number of self-compassion activities, exercises, and podcasts. And the podcasts are short. And so I really like, in terms of, you know, maybe the gratitude, the self-kindness, or the touch of endearment aren't going to work for you right now. There's a long list there, and there might be something there that you can do. And so in particular, there's 3 activities on there at that website, and selfcompassion.org, that there's the compassionate body scan, there's the affectionate breathing, and there's the loving kindness. And those are also 3 activities that I really personally like myself. So, and I recommend you check out. So to summarize, you're going to check in with yourself, low battery or good battery. If it's low, you're going to do validate, step 2, and then step 3, you're just simply going to distract. And I say simply, but it's not that simple. If your battery is good, then step 2, you're going to validate. And then step 3, you're going to counter the negative statement with either gratitude, self-kindness, a touch of endearment, or some other self-compassion strategies. So now I wanted to shift gears a little bit and talk about, you know, the body checking habit. This is something that we see a lot of in body dysmorphia, but we can also see it with negative body image and eating disorders. And I get a lot of questions about how the body checking habit. And so I want to say, I like to call this stirring up the body checking habit. Judy, I saw you come on. How are we doing on time?
Yeah, 5 minutes total. That includes questions. Yes.
Okay. Okay. So, so in here, first, you're going to want to engage in a collaborative discussion. And you're going to want with not only the treatment team, but the loved one that, and the goal here is to stir up the habit. It's not to stop the habit necessarily. It's to just help them. And sometimes the habit is so automatic. It's so that they're doing it unconsciously. And so sometimes you just want to call it, you want to create this acronym for it with your loved one, so that even if you're in public, you can say, hey, BC, BC. And that means to them, you're bringing it to their awareness, you're body checking, which helps them not only become more aware, but they can move towards disrupting or stopping it down the road. But it also does it in a way that nobody else around you knows what is going on. You can do things like covering the mirror to help with the stopping or disrupting or stirring of the body checking habit. The other one that I would just want to say, since we're running out of time, is delaying it. Sometimes to help individuals gain control, the goal may be just, okay, you've gotten this urge to fix your appearance or to body check, like, let's just delay it for 10 minutes. This also helps them to gain control over time. And so in the resource page, I've included links on, activities, one in particular, and it's on dialecticalbehaviortherapy.com on resist technique, which is 7 different ways you can help loved ones resist an urge, which can be really helpful. Okay, the last 2 things I want to just mention is I've added some things that, as a family, what can you do together and bring in others that may not be, that aren't eating disorder recovery or body dysmorphia. Something that you can definitely do is detox the digital feed, which means 2 things: unsubscribe from that which is harmful, and then subscribe to things that are helpful, and that can be neutral. And then there's a helpful video that you can check out on detoxing your feed, A Parent's Guide. It's by Dove Self-Esteem Project and Dr. Philippa Diedrichs. And so that's in the resource page. And then the other thing I'll talk about is just as family, and again, this depends on where you're at as a family, the body talk jar, which is very similar to the swear jar in the United States. And this is where every time somebody says, like in the swear jar, someone says a curse word or a bad word, they put a marble or a coin or their name in the jar. This is the same idea, but with body talk statements. The goal here, though, what I really like to push for families is to have fun with this. You can, as a family, you can determine how all the rules related to this. There are some families that decide, okay, at the end of each day, whoever has the most names in the jar has to pick up dog poop. But then there's some families, and I can think of one in particular, where they decided that if you lost at the end of 1 week, the rest of the family got to dress you for 1 day. And so I remember this 13-year-old talking to me because the first week they implemented this, Dad lost. And so they dressed Dad in an outrageous outfit. And her enthusiasm and her, about it. And in the process, right, they were reducing their body talk. Now, again, the rules are dependent on where you're at, where the person in recovery is at, what's feasible. And so again, you can tweak with this in a different ways, but you can do a number of things. The last thing too, and I'll stop here, is encourage hobbies that like gardening, learning to sew, knitting, finding ways for your child to interact with their bodies in different activities can also be really helpful. So thank you so much. I'll stop there. And I'll take, I know we, and
we're actually out of time totally. So what we'll do is we will send you the chat.
Yes.
And perhaps when you have time, you can answer the questions.
Yes.
And we will get the answers to the participants. Because, these questions, unfortunately, this is a complex issue. Parents are dealing with very nuanced cases. It's not an easy answer, and it's not a quick answer. And I want to do all the parents justice who took the time to send questions. So your questions will be answered, not at this point in time. Thank you so much for a wonderful presentation. I believe everyone, the next session is in about 5 minutes. So just follow your next Zoom link and we will see you there.
Thank you, everyone.